Mrs. Threadgood is a 65-year-old female with Parkinson's disease, and her presumptive diagnosis is chronic generalized periodontitis. She has infrequent dental visits and a history of cavities. Her medications include Sinemet for Parkinson's and antidepressant medications. She presents with sensitivity to cold and sore and bleeding gums when brushing. She also notes that her mouth feels dry and has noticed some holes in her teeth. She drinks soft drinks, wine, and sweet tea about 3 times a week, and snacking between meals consists of soft, sugary foods. She notes a loss of taste. She has smoked 2 to 4 cigarettes a day for 40 years, and her gingiva has receded. In addition to oral symptoms, she notes frequent urination, weakness, and fatigue. This video will explain aspects of treating Ms. Threadgood and focuses on risks and symptoms that are due to Parkinson's disease. Patients with Parkinson's often present with the slow and shuffling gait. Offering your arm for assistance helps with stability. Remember, always ask and never grab a patient.
It's always a good idea to review the medical history and take vital signs prior to treatment. We have just finished that with Ms. Threadgood here, and everything's a go. And now we're going to start treatment. Ms. Threadgood, would you like me to lay the lead apron on you for the treatment?
Yes.
This is helpful for Parkinson's patients because the weight of the apron can help soothe their tremors. So I'm going to lay the lead apron on Ms. Threadgood to make her feel a little bit more comfortable with her tremors. This can stay on her the entire treatment, but always communicate with your patient to find out if they're comfortable or not. I'm going to lay Ms. Threadgood in the semi-supine position now, because laying in the supine position may give her trouble with dysphagia due to the Parkinson's. Okay. Shorter appointments are easier on the patient because sitting a long time can become uncomfortable. Also, stiffness in the jaw due to rigidity can become uncomfortable during treatment. So recommending a bite block, like this one, can be helpful during treatment. Cradling the patient's head, like so, is also a safety aspect to prevent injury to the patient and to the clinician during treatment. We just finished the oral exam on Mrs. Threadgood, and I'm going to sit you up and talk about the findings. So as with many patients with Parkinson's disease, it's common to have periodontal disease, and with you, I recommend using an electric toothbrush. I would like to show you these different types of toothbrushes, if that's okay with you.
Okay.
So here's the manual toothbrush with a wider handle. Using this can help, but I don't think that this handle is wide enough for you to hold on to comfortably. So this is the electric toothbrush. And while using this, you're going to want to angle it so that it's up in the gums. And it's going to vibrate at the same time you're using this. So it will remove plaque and tartar easier than the manual toothbrush that you're currently using. Does that sound something that you would be interested in switching over to?
Yes. I think so.
Okay. I also noticed some cavities on some of your teeth. Is it okay if I talk to you about nutritional counseling? So it's really important to reduce the amounts of soft and sticky foods that you're eating. I understand that this can be easier due to the stiffness and trouble chewing with your jaw, but it's really important to focus on eating foods that are not going to stick to your teeth, such as breads and crackers and sugary sweets. All right, Ms. Threadgood, I just finished with your treatment for today. I'm going to sit you up. So with Ms. Threadgood, her recall appointment will be 3 to 4 months, but this will be individualized with each patient depending on their needs. Thank you so much for coming in today, Ms. Threadgood. Do you have any questions?
No.
Great.